I was born a healthy boy because they always used to ask me, Job, what is happening? Every time we had a gathering, what is happening? My posture was changing because I used to be upright, but unfortunately my phosphorus and potassium were slightly low, below normal. And the doctor who had sent me said this is not significant. And that X-ray was even showing the hip joints. Now, from that X-ray, the bones were really worn out. The hip joints were really worn out. But before I had done the X-rays, but they were not worn out. Imagine I think that was the lowest moment in my life. And so my sister used to ask me, why are you limping? That's when I started developing some lower back pain.
Yes. Hi guys, this is Health Focus. This week's episode has taken us to Mathira constituency, Nyeri County. And to us who don't know where that features in the map of Kenya, it is in Karatina town. We've come to get the stories of patients who are having the hope of getting healed and getting better. Our word this week comes from the book of Psalms. Oh Lord, I have come to you for protection. Don't let me be dismayed. Save me, for you do what is right. That is the hope of our patients. Let's get onto it. Our guest today is my colleague. He is a health professional. I have personally worked with him, and I do not want to preempt anything about him. Kindly welcome him to the show. Welcome, Jesse, to the show.
Thank you.
Welcome to Health Focus.
Thank you.
Please introduce yourself to the viewers.
Well, I am Jesse Njogumo, and I'm a registered nurse, though currently not practicing. Yes, I have not been practicing for 2 years, but after I got my license, I practiced for almost 10 years.
10 years in practice. I attest to that. I once worked with him, and he is such a vibrant nurse. And because we are featuring, we want to go back on the training, but we'll mention where did you train in a nutshell, where did you go to school, and where did you train?
Yeah, to start with, I am born here in Nyeri County, Mathira. I went to school, first of all, primary school. I went around here, a school called Kadhaidi Primary School. Then high school, I went to the other side of Nyeri, called Watuka Secondary School in Endarasha. Then after that, I completed in 2004. Then in 2006, September, I joined Chogoria Hospital, that is Clive Alvin College of Nursing. And that's where I did my diploma in nursing, Kenya GSAT Community Nursing, up to 2010 February. That's when I completed.
Awesome. And then after that, you joined the workforce.
Yes.
Because we want to know your journey, take us back to the initial seasons of your illness.
Okay. To start with, I was born a healthy boy.
Yes.
And I believe that's why I was called Jogu. Jogu means elephant.
Yes.
Kikuyu.
Yes.
So I was a very healthy guy. Even in school, in primary school, in high school, I used to participate in athletics. I did not have any issues. even in college I did not have any issues. But after I completed college, then during my second year of practice, that was in 2011, that's when I started developing some lower back pain.
Yes.
And after the lower back pain, so from there I underwent, okay, first of all, at first I did not take it that serious because, you know, we used to work
Yes.
in accident and emergency Kikuyu.
Yes.
And we used to be very busy, so I used to think that it was because of the kind of work
Yes.
we,
You were doing.
yes. But later I saw that even after going for some day offs, resting, still the pain was there. I underwent some investigations, nothing was visible, everything, x-rays, blood works, nothing was visible. So I just used to do some muscle relaxants. And from there, let me say from 2012, that's when how the pain started getting worse. And I started developing something called radiculopathy. Or anytime I had, maybe I sleep, my legs could slip, or I stumble, I could feel like an electric shock on my spine. But still, when I went to consult orthopedic specialists, nothing was visible. I actually did about 3 MRIs, and they all could not show anything.
Everything was normal,
Everything appeared normal.
but the pain was still
The pain
excruciating.
was very much, and I was referred to the physician, Dr. Wike, you know.
Yes.
I loved that one. I love that one.
Yes.
So then she did all the tests she could, because now that's when now you have to rule out anything possible. Is it TB spine? Is it even HIV?
It was tested.
I got tested for everything.
Everything was normal.
Everything was normal. So in 2015, I was referred to a neurosurgeon in Nairobi. I think it is Modia or Ipude or something. So the doctor there, after he saw my radiologists or the MRIs, he said, no, if these are not normal, this is not my work. Because my work is to operate.
Do surgery.
I cannot operate on something that cannot be seen.
Yes.
So he referred me to a neurologist. That was a neurosurgeon, so he referred me to a neurologist.
And this time the pain is growing in
Yes.
intensity.
And by that time, even my posture was changing, because I used to be upright, but unfortunately now by that time my spine was kind of curved, and I was growing shorter. I was growing shorter, and I was losing weight. So when I went to see the neurologist, now maybe somebody would wonder, what's the difference between a neurologist and
And neurosurgeon. Yeah.
Yeah, a neurosurgeon is the person who operates on the nervous system,
Yes.
surgery.
Yes.
But the neurologist only deals with the treatments, medical treatments.
The physician who treats
Yes.
the neuro
Perfect. Physician,
pathways.
yes.
Yes.
Yes. So the neurologist, wow, okay, I can't even remember his name, but he had some breakthrough. But he did a lot of tests, even nerve conduction studies, something I had not seen, and Needles were being put through my calf muscles. And anyway, in 2015, around November, that's when he sent me for another X-ray. X-ray of the lumbar spine. And that X-ray was even showing the hip joints. Now, from that X-ray, the bones were really worn out. The hip joints were really worn out. But before I had done the X-rays, but they were not worn out.
What is the duration of the before X-ray and the current X-ray?
About 2 years.
Okay.
So the wearing out happened in a period of around 2 years. So that's when he told me now, this could be something. So he sent me now for one last MRI of the spine. And that only showed, okay, the MRI was talking about a vascular necrosis. That is hip joints that have been depleted of blood.
Blood circulation.
Yes. So, okay, at first that was something, but you see that was just a symptom. Okay, is it a symptom or sign?
It's a
sign.
It's a sign, yes.
Yes,
It's a
sign.
sign.
But it's not a cause.
So they were saying like the veins taking the blood and the arteries taking the blood to the hip joints
Yes.
had worn out.
Had one out.
So the hip joint was not getting enough blood.
Yes.
That's why it was dying.
Yes.
Okay.
That was now from the MRI. So the neurologist told me now, from here, this is not mine. I'll refer you now back to the orthopedic surgeon. Let me take you back a little bit, about 2 years before that, where we used to work.
Yes.
I had done, a certain doctor had sent me for the bone profile, bone chemistry, that the calcium, phosphorus, and the levels were slightly low. But this is something I have come to learn. And this is something I'm trying to fight. Or I'm hoping I can win. I'm hoping I can fight. We medics sometimes we have been given levels to
Yes.
work with.
Yes.
We are told that the normal levels should be, say, between 2 to 5.
Yes.
So, but if you see something like 1.9, we say it's not significant. And that's exactly what had happened that 2 years earlier. My phosphorus and calcium were slightly low, below normal. And the doctor who had sent me said, this is not significant.
But maybe it isn't. Maybe.
Maybe it isn't.
Yeah.
But what I've come to learn, as long as it's even a 0.1 below the normal levels,
Range. It
should,
is significant.
somebody should work on that. Because the reason why there are these ranges, yes, we used to, in maths, we used to say the error, there is always a certain error. But I believe that's why there's this range
Oh, yes.
between 2 and 5 because of some errors. So if we see some slight deviation and we call it insignificant, somebody should define what is insignificant and
What is significant?
yes, because now after that, so when I went to the, actually I did not go first to the orthopedic surgeon after the diagnosis. I called a friend of mine who used to work in the orthopedic theater.
Yes.
I told you now, this is what the MRI is saying. Before I go any further, what do you think are the probable management plans here. So he told me, now this, you need bilateral hip replacement. And now where we used to work was used to is
Hip
that.
replacement.
Yes. And hip replacement, for my age, I was told there's cementless and there's cemented. So, and then after I heard that, now I was wondering, now my life is going to change. Because now, yes, I was walking. Even if I was limping, I was walking. And you could not tell me I had a problem, because
Yes.
I'm walking, I'm doing it. And then this bilateral replacement, so both legs,
It'll be cemented.
yes,
No much mobility.
no more mobility. So, and if they are, I think cementless, it means there'll be a chance of dislocations.
Yes, there is a chance.
Multiple dislocations.
But have we handled the lack of venous and arterial circulation?
No. Actually, even when I went now to the orthopedic surgeon, he said, now here you need total hip replacement.
Oh, okay. He agreed with the...
Yes. But now, that hit me like I don't know whether a truck or a hurricane, but imagine I think that was the lowest moment in my life. That was the lowest moment.
That was 2015.
2015,
Yes.
December. But that lowest moment only lasted for less than a week. Yes. That's why I told you I'm an elephant.
Yes.
So after that, I told my family, my whole extended family, because they always used to ask me, Job, what is happening? Every time we had a gathering, what is happening?
Because your walking posture is changing, you are growing shorter, you are in pain.
Yes. And by the way, let me take you back to 2011. It started with the moment I was getting the lower back pain. I also had a shoe that was tight. And so my sister used to ask me, why are you limping?
Because the shoe is tight.
Thank you, yes.
That's what you thought, Ama, that was the reason?
That was the reason. So when the orthopedic surgeon told me I'm going to have bilateral hip replacement, and then I told my family. So my family asked now, it took these guys almost 5 years to get this symptom or sign, not actually the actual cause.
Yes.
So they are not comfortable for me to have the surgeries here. So they said they're going to do whatever they can, and we got some well wishers. My family did a lot. Our colleagues did a lot at work. I have very great friends. That's why I told you that moment. That moment I was very low. Immediately after I heard about the
Total hip replacement.
yes, that moment lasted for a very few days, because after my family said they will do what they can to support me, maybe to go to India for further investigation and treatment. Then when I went back to work, I told my colleagues, my in charge, I can't remember who was my in charge. I think
It was Mekari.
yes, yeah, it was Jane. And the staff came through for me. My family came through for me. My friends, the Dick brothers, the ones you saw that photo. The other guys that came through for me are my former college mates. Wow, they did amazing things. So from there, I started feeling alive again because there was some hope. Now the other challenge was now, who do I know? How do I go to India?
Yes.
Now there are all these agents everywhere. Everybody. Actually, when I said that I'll go to India, people came from all sides, and people I had not told. They want me to go to India through them. But funny enough, I went to our hospital system computer. I googled about total hip replacement in India for a young person, for a youth. And this one doctor popped up. And I saw the surgeries he had done. That after the surgery, you could even cross your legs, you could do anything. I said, this is the one. And I'm telling you, I did not go to India with any agent. I talked to that doctor online, we connected, and that's how I went to India. So when I went to India, I was first to have one leg operated on, as they were carrying on some investigations. Because when I went to India, immediately they repeated the calcium and the phosphorus. By then, they were very, very low. Significant. Now this was now significantly low.
Low.
Yes. So first I went to surgery for one hip, but during the surgery, it was under general anesthesia. So when I woke up, the doctor told me, now your bones are as brittle as an eggshell. We cannot operate on both legs simultaneously. We have to first investigate further, then see whether you can come back with this after a year for the other surgery. So they did investigations, bone density scan, everything, and that's when they realized my bones were very weak. My body could not process vitamin D. So without vitamin D, calcium and phosphorus, yes. No matter how much fish or anything I eat, that cannot help me because my body was not processing. So, that's I started seeing an endocrinologist. I saw several.
In India or in the
In
country?
India. Still, I'm in India for 1 month. So that 1 month, I saw a whole lot of specialists, from cardiologist, endocrinologist, nutritionist to guide me about nutrition. So, and by the way, when I went to India, I was shocked about something because I used to work in a place where we used to weigh patients every day. But I think maybe even if I weighed myself, I never took that weight seriously. But when I went to India, my weight was 38 kg.
Oh.
And before that, before the illness began, I always ranged between 60 to 65.
Yes.
So I was like, no, that's not my weight. Even in India, I was like, no. They even brought another weighing scale because I could not believe. You see, for us men, we are not used to looking at ourselves in the
The
mirror.
mirror.
So even if somebody tells you that you're losing weight,
You don't see it.
yes, actually, you see, I told you my gait was changing. I had not recognized that my gait was changing. People used to tell me even at work. This is not the Jesse we knew. Jesse was straight now, anakaa kama amepigwa na. So those guys were very vigorous on everything, and I was started on medication.
Now, before they start medication, were they able to identify the cause of this illness?
Now my liver is the one that cannot activate the vitamin D.
So does this thing start at adulthood?
Now this is a question even today. The endocrinologist I see, Dr. Acharya, always asked Jesse, are you sure that when you were young you never suffered even broken bones or anything? I tell her no. Actually, I used to work jobs that young people, nowadays people cannot work. If you hear somebody telling you that they have worked in a tea factory, a section called green tea section, if you tell somebody that, somebody who knows about the tea factory, they will tell you you are tough. That, and I worked there after college. So even the doctor, even today, I think this is what we can call idiopathic. The cause is unknown.
Cause is unknown. Because if it's the liver that's not processing,
Yes.
it does not. Was the liver ill? Okay, let's
No.
just imagine.
The liver, the kidneys, everything were working. Even today.
Even to now, they're
Even
working.
to now they are
The only thing they are unable to do
Yes.
is produce what is going to
To activate, yes.
vitamin D
Thank you. Yes.
to be able to consume calcium and phosphorus for
Yes.
the bones and the teeth. But then again, I go further and ask, how come the teeth were not affected? That's just...
Before all this, I could have is it called panoramic? Panoramic view of everything.
Yes.
After India, I could view ahead properly and even up. Right now, I tell people, I'll tell you what is down here, and you tell me what is up there.
Oh, you can't look up.
Yeah, unless I'm seated.